Uh, Hello, everybody. Welcome to Casual Conversations. Hi, Jessica. Hi, Hirsch. Hirsch, you are a loyal member. Cindy, Stella, Janet, Jen, thank you for coming in today. And I'm really excited to have you in our afternoon. More coming in. Kathy, Nola, Jen, Janet Hines, hi. Kathy, Ramy. It's a really exciting day today, so I'm glad that you all could miss us. Hi, Kara, Allison. Hello, Hope from Exeter. Hope is the ones that is our PhD student who does our notes and is helping me finish the book. Well, thank you everybody for coming today. I am just going to change my view. Hi, welcome to Casual Conversations. This is Katherine Snedaker, and I'm very excited to have our guest today, Tracey Covassin. Our Casual Conversations comes from originally from the Brain Injury Professional magazine, where we looked at women versus brain injury, and now has evolved into speaking with brain injury professionals. And I'm so excited to have Tracey on the show today because in my perspective, Tracey was the earliest and the first work that I saw on women in sports and concussions. So welcome to the show, Tracey.
Thank you. And thank you so much for having me today.
So usually in our program, we go back to the beginning. And I wanted to ask you, what first started your interest in sports?
In sports or concussions?
Well, let's start with sports, because I know that
sports
has always been a part of your world.
Yes, sports has always been a part of my world. My parents have always believed when we were growing up that we really were limited in the TV and we really didn't have video games back then. And you go outside and play or you do sports. So I originally started off actually as a little figure skater and then went into gymnastics, liked it, but had back issues. So then I actually went into tennis around the age of 12, and I ended up playing at university at McMaster University. And then I kind of just stayed within tennis, and then I've also skied a lot. I grew up just north of Toronto, so it's obviously very cold here. I lived in Calgary for 2 years, absolutely loved it, and got to ski all over Banff and went to Whistler. So I've kind of always, had sports in my life and enjoyed it and still enjoy playing tennis when I can.
And then what was the transition to the career that you have now?
I think like a lot of athletic trainers, I was always injured. I always had knee and shoulder and ankle injuries when I was growing up. And I actually got a degree in psychology for my undergrad at McMaster. And kind of into my end of my third year, fourth year, I decided I wanted to go into athletic therapy, which is what it's called in Canada. And I decided I wanted to do that in the States. So I ended up moving I knew at that point, I'm going south, I'm going warm. And straight down Calgary was Las Vegas. So I ended up going to UNLV, did my master's there in athletic training, become a certified and a licensed athletic trainer, which I run the graduate athletic training program here at Michigan State University. And then I ended up going to do my PhD at Temple University.
And how did concussion, there's so many different injuries that athletic trainers care for. When did the concussion piece start to interest you?
So when I went to do my PhD at Temple, it was in Philadelphia. And as I said, I grew up as a Canadian and outside of Toronto, which means you are a Toronto Maple Leaf fan. So they are my absolute beloved team that can never win a game 7 in the playoffs, but we still cheer for them. And when I was in Philly, Eric Lindros was playing for the Flyers and he had numerous concussions. I actually wanted him to play for the Leafs when he was younger. He did end up playing there later in his career. but he got a few concussions when I was in Philly, and I thought that would be interesting to start to study because back in the early 2000s, it was starting to become a big problem in NHL and in the NFL. And when I started looking into it, all of the research was on either ice hockey players, boxers, or football players. And I thought at that point, there isn't a lot on females. At that time, they were also researchers at Temple that were looking at ACL injuries and were finding that they were more prevalent in females. So then I thought, well, if ACL injuries is more prevalent in females, maybe concussions are also more prevalent in females. So I decided that I wanted to start looking at differences between males and females.
And from what I remember of your research, those differences popped out right away with the very first study.
Yes, so I actually was fortunate enough to get access to the NCAA data before it was actually with Dataless. And I was able to publish two studies. One specifically looked at sex differences between male and female sex comparable sports at the NCAA level. And those particular studies found that female soccer players, basketball players, softball players had a greater risk for a concussion compared to males. So that was actually the first study that I ended up publishing that looked at differences between males and females that actually looked at more of concussion injury rates at the collegiate level.
And that was 2003.
I believe that one was published 2003.
So we're talking 20 years ago now. And that's the part that when you look back at these dates and realize how long you've been doing this work and how repeatedly the work has shown similar findings, and yet we still get another study that comes out and reporters are like, oh, we've just found a difference in concussion. It's a little bit like Groundhog Day. What was then the next after that study? Where did you take your research?
So, as I said, that was the first one that looked at the concussion injury rates. And then for my dissertation, I actually wanted to examine differences in neurocognitive performance between male and female athletes. I actually had 5 universities that agreed to participate. I literally didn't even know about the impact neurocognitive test battery back then until I read it in 2001. It was literally a paragraph in a paper of them talking about it. It just started to become used at institutions. So I decided that I wanted to look at neurocognitive function at baseline and post-concussion. So I literally drove around the state of Delaware, New Jersey, and Pennsylvania to collect data for my dissertation. Baseline tested over 1,000 collegiate athletes and then post-tested athletes. And for that study, and which was my dissertation, I did find that female athletes had lower visual memory, and they also had a slower reaction time compared to male athletes after their concussion. So I kind of went from looking at injury rates to looking now at, are there cognitive impairments and are there differences between males and females after they have their concussion?
And now I think we're close to, if not over 200 papers later. What paper would you like to talk about today?
Actually, there's 2 papers that I want to talk about, but I do want to point out, so on the call, in one of my little boxes is my former PhD student, Abby Bretson. Abby is actually doing her postdoc at the University of Pennsylvania. She's there, she just waved. And Abby actually first authored this paper that just got published this year in JAMA Network that we have worked on with researchers from the University of Pennsylvania, as well as a researcher from the UK. It actually got a lot of press, but because we are talking about sex differences and because this literally was just published a month ago, I thought I'd discuss it a little bit and some of the findings of it, and then just talk briefly about a study that I also published this year. But this study looked at sex differences in soccer concussion incidence and characteristics. So We have been fortunate enough for about the past 5 years to be working with the Michigan High School Athletic Association. And the Michigan High School Athletic Association has a head injury reporting system. And they actually mandate every single high school in the state of Michigan, they have to report all the athletes who participate in sanctioned Michigan high school sports, as well as all of the concussions that occur in practices and competitions. So this study, we looked at differences between males and females in soccer from 2016 through to 2019. And what we really wanted to do was not only look at the injury rate again, but look to see who was the initial examiner. So, who was the initial person who assessed them? Was it an athletic trainer or was it not an athletic trainer? What was the mechanism of injury? Was it person to person contact? Was it person to object, which was typically person to the soccer ball? Person to the playing surface, so the athlete hit their head on the ground or they weren't sure. We also wanted to see were they removed from play, so at the time of their injury, and then we wanted to look to see when they were returned to play, which was full medical clearance, so they had to go through the stepwise progression. Did male or female soccer athletes take longer to recover and go back to full clearance? This particular study, we had 950 female athletes who had a concussion and 557 male athletes who had a concussion. And similar to our previous research, particularly at the high school level, female soccer athletes were at almost a 1.9 times greater risk for a concussion compared to males. So that's pretty close to almost a 2 times greater risk for the female athlete compared to the male athlete. In terms of some of the other variables that I had mentioned, we did have 82% of the soccer athletes were removed from play on the day of their injury, and 71% of them were actually assessed by an athletic trainer. But the one thing that we found, two things that were interesting. One was that, which wasn't necessarily, what I was thinking at first. We found that male athletes were more likely to be removed from play than a female athlete. So that was something that was actually new for us. And we found that the median time to return to play was 10 days for a male athlete, but it was 12 days for the female athletes. So one of the things with this one, was that the female athlete took 2 days longer to recover from it, but the fact that males were actually more likely to be removed from it. And, some of the reasons for that could be is that the female actually didn't have symptoms when they got their concussion. So if they got hit, but they didn't have symptoms, if there wasn't anybody there to actually witness the hits and the athlete didn't have symptoms, then they couldn't have been removed because they didn't know they had it. Or it could have been that what we do find is that females tend to have more knowledge and are more likely to report their concussion, but when there's been other research that has been done, they find that both males and females don't think it's as serious as it should be. So it may just be that the symptoms that they have, they didn't think that it was serious. So then they did not tell anyone. So they either didn't tell their athletic trainer, they didn't tell their coach. So then they were not removed from play. Or it just could be that females actually have symptoms later when they're concussed, so that their symptoms may not have appeared, and that's why they weren't removed from play. But that was something that we thought was interesting, as well as the 2 days that we found. As we said, the median concussion, so there was almost 1,000 concussions for females, and 500 of those athletes took longer than the 12 days to recover from it.
Tracey, did you look at how many of the male versus the female players had athletic trainers actually there?
We were not able to determine based on male or female, but we did know there was 53% of the high schools in the state of Michigan that had an athletic trainer. And we don't know though if it was, which high schools actually had those athletic trainers. Unless, I think unless it's a private school or a school that doesn't have football, a lot of them, for this particular study, it was soccer. So most of them had, if they had a female soccer team, they had a male soccer team. So they would have actually had, as far as, fairly even access to it, considering it was the same sport and most of the high schools would have female soccer and boys soccer.
But would they necessarily have an athletic trainer on the field to assess, to pull kids?
Not necessarily.
Okay. All right.
Not necessarily.
I just feel like with the female athletes don't have access to the same amount of time, and especially if there's a football team, I feel like that the athletic trainers are pulled over to what they feel are more critical sports. So I'm sorry, please continue.
Oh, okay. So the other study that we also just published within the past couple of months, with my colleagues. So we were very, before I talk about the study, we were very fortunate that the Journal of Athletic Training, which is Athletic Trainers Primarily journal, they published a whole issue on women researchers. So I was privileged enough to be asked to also contribute to this journal with my co-authors, which was also Dr. Abby Bretson, Dr. Erica Beidler, and Dr. Jessica Wallace. We're fortunate enough, the four of us were able to work on this paper together. And this particular one, we actually used the Michigan High School Athletic Association database, but what we really wanted to see with this one is we wanted to look at time to return to participation. And again, this time to return to unrestricted participation was full medical clearance. And it was after they went through the stepwise progression, but we really wanted to look at differences in sports. And we wanted to see, were there any particular sports where individuals took longer to recover from their concussion? So this particular study, we also were able to examine from 2015 to 2019. And because this one included all sports, we had over 15,000 sport-related concussions. So that is a large number of concussions. And because we had football included in this one, there was over 10,000 concussions for males and over 5,000 concussions for females. So again, it was 2-to-1 more prevalence in the number for males, but that doesn't mean that the males were at an increased risk, because you have to factor in players on the team, especially when you factor in if a football team has 50 athletes. So for this particular study, we also found we wanted to specifically see how many of these 15,000 athletes had taken 7 days or less to return to their sport, how many had taken 14 days or less, and how many had taken 21 days or less, and how many of them actually took longer than 28 days. So this particular one, the one thing that we found surprising was that 30% of all these concussions took longer than 14 days. So around 5,000 athletes who had a concussion took over the typical average, which was 14 days in the literature. But then on top of that, within that 30%, we had over 2,000 athletes that took longer than 21 days to recover. And we had over 1,000 athletes who took longer than 21 days. So even though from a research perspective, we typically say athletes will recover from their concussion within 14 days, and there's this, percentage of individuals who will take longer than that typical 14-day recovery and have this protracted or longer recovery. But when you actually put numbers to it, because when people think about it, 15 to 20% is not that much of those individuals that take longer to 14, but we had over 1,000 athletes who took longer than 21 days. And I kind of, deemed 21 days as a month. So they took over that. And the two sports, particularly one sport that we found was kind of surprising for us, was the female gymnasts. So we had 25% of female gymnasts that took longer than 28 days to make a full return to unrestricted participation. So that is 1 in 4 gymnasts who are female will take longer than a month to recover from their concussion. And that was followed by 15% of competitive cheerleaders. So those were the two big female sports for us that took longer than the 28 days. And then male wrestlers, 12% of those male wrestlers also took longer than the 28 days to recover. In terms, if we think of overall, if we think of gymnastics, especially now that the Olympics are coming in the next 6 weeks. When we do a stepwise return to participation, so after we do the light aerobic activity, and then we start doing sport specific skills, it's pretty easy to have athletes who are basketball players. Okay, so what's a sport specific skill? We'll let you dribble the ball today. We'll let you shoot a free throw. Those are sport specific skills. In soccer, okay, we'll let you maybe, dribble the soccer ball around. Maybe we'll let you just stand there with no goalie, nobody else around, just kick the ball into the net. So those are your typical sport specific. Even in football, you have a quarterback or a running back, they're just going to pass and catch. Well, the most basic sport skill that is taught in gymnastics, the very first one that you will have a 3-year-old do, is a forward roll. And if you think about a forward roll, well, what is that person doing? They are flipping themselves upside down. So they are now flipping themselves upside down. Well, what we do know is that females tend to have an increase in vestibular symptoms. So they have these increase in their vestibular symptoms, as well as some ocular symptoms. And when you have these gymnasts doing light sport specific skills, you need to be careful of which ones that they're doing, because anything that's inverted, which is a handstand, a cartwheel, a forward roll, all of these could increase the symptoms, which is why these gymnasts are taking longer. So sometimes you would start these gymnasts off by just doing leaps, just doing some basic skills, but it's still hard to get them past that sport specific skill to get them to actually, increasing the next step, which would be adding a cognitive component to it. And we typically deem that as like a light practice that combines skills and things. Well, you got to think of what is the next phase of that for a gymnast without, having them obviously injure themselves. And the other thing is they're very, it is a sport that you have to be more cautious when you return them. And this is both gymnastics and cheerleading. In terms of if you've ever seen competitive cheerleading, obviously they throw them really high up and we always hope they catch the cheerleader, but we also know that even the person at the base, so Katherine and I were talking about this earlier, the person at the base in cheerleading, they might get a knee to the head. When they're doing stunts, so paired stunts, and they accidentally drop their partner, they could end up hitting their head on either on the mat, or if it's at a basketball game, hitting their head on the floor of a basketball game. So all of these things, will increase the risk for these athletes. So for us, that was kind of I don't want to say surprising, but it was one of those studies where we weren't expecting the gymnasts and the cheerleaders to end up actually taking more than 28 days to recover from their concussion.
Someone was asking in the chat about previous concussions, and we talked about that earlier, that gymnasts who start at 3, I mean, you usually walk on to be a gymnast at age 15, like you have a long history. Was there any way to ask if they had past concussions?
We did ask them, Abby, help me out. Now I'm drawing a blank.
Yeah, so in the paper, we describe the concussion history outcomes for those with concussion history. And there were some different patterns within sports, but yeah, we have a table that outlines just overall what the recovery timelines look like, and then what it looks like adjusting for concussion history in that paper.
I think that would be interesting, just compared to like lacrosse, that people can walk on in high school and play that sport, where I think football and I mean, around here you don't start soccer at 12, you start soccer at 5. So I mean, I think regionally too, there are places where people start earlier. Well, that is just absolutely fascinating, the work that you've done. And in the time that we had left, I wanted to switch over. So what do you want to do next? What's next for you think for the field of concussion and what you'd like to accomplish? I mean, I think you already have 7 papers published in 2021. So you're a mover and a shaker. So what's next for you?
I think, post COVID, which has been difficult for everyone. Previous to COVID, I had a doctoral student, Jennifer Savage, who actually looked at return to drive. And we were actually privileged enough to build this car and install a TBI software that's actually used in TBI research that looks at, for her, she looked at concussed individuals to see what happens in return when they go into the return to drive phase. So it actually looks at, how many tickets they ended up getting. Did they go over the speed limits? It looks at memory. They have to memorize things. They have to pay attention to when I say this all the time at Michigan State. If you've ever been here, we have these students who tend to walk like right in the middle of the street, don't pay attention to the cars coming. So it actually measures, did you hit it? Did you hit a car? Did you hit a person? So while we didn't have the sample size of the numbers to be able to compare differences between males and females, I still want to continue with that and collect more data with that, because as we know, females are at a greater risk for a concussion, but we also know the teenage drivers and 16 to 21, 25 males tend to be more aggressive in their driving. And while we didn't find significant differences, as I said, between males and females, what we did find that I was absolutely shocked was that out of our concussions, 48% of them had either hit a person or hit a building. So our concussed athletes actually hit people in this. And I know like the car that we have, it doesn't give you the same feel of it, but it actually, my collaborator on it, Dr. David Ferguson, he actually does work with race car drivers. So it's built for a race car driving study. So he actually, when I was back at MSU a couple of weeks ago, he had race car drivers in it and they were driving this thing at 200 miles an hour. So it is designed for driving, but that was something that really, 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 it just surprised me, because we had over 80 just regular college students who did not have a concussion, and not one of them hit a person, not one of them hit a building. And then we put our concussed athletes in, and half of them hit either a person or a building. And that was just one of the things that I thought was like surprising, that the reaction time was slower in it. And, at first it was like, well, it's because, it's not really, it's got this, I'm telling you, it's got a steering wheel, it's got brakes, pedal, it's even got a stick shift. They were not allowed to stick shift. The car could actually move if you crashed. We didn't do that for the concussed people, but that's what it does for the race car. But they just seem to be slower at it, and they seem to be slower to react, because one of the scenarios it does, literally, I do describe it as Michigan State. All of a sudden, this person just goes right out in front of you, and the person wasn't able to like see it in time, and then just hit the person. So it was something that I think startled me just for that. So I'd like to actually continue with it. As I said, we hadn't done anything with it for the past year and a half with COVID because of it, but I would actually like to put more for ours. It was a lot of the college students. We want to get younger high school kids in it. The state of Michigan has, and I still find this unusual being a Canadian, but you can actually start driving at the age of 14 and 8 months, which to me is too young. But because of that, individuals get their driver's license fairly early. And I think we know high school drivers are not, I wouldn't say that the best driver that's out there. So now all of a sudden you put a high school kid who has a car and now they're recovering from a concussion, and you put those two factors together. I think that just is not a good scenario. Let's just put it that way. So looking at return to drive is something that I'd like to get back into.
I think that's really important, especially with the high school students, where they'll have the student drive to school, spend what portion of the day they can, and then when their symptoms peak, they're allowed to leave. So they're now not well enough to be in school, but they're driving home. And I mean, I have heard with interns coming in, people that have been on concussion watches and gotten in fender benders. The other thing that I've noticed, and I've never heard this from a male, but female athletes on the field, concussed, say they're fine, and then throw up 3 times driving home, like actually stop the car, throw up, keep driving, stop the car, throw up. And I've heard that so many times for females. I often wonder if it's the symptoms coming later, or the motion sickness once they're in the car, or what that piece was. But I've never had a male talk about that. And so often here that's, well, how did you know you were concussed? Well, I had to pull over and throw up 3 times, which is not usually a girl's activity.
Yeah, so I do know some research has shown that females, almost close to 30% of females have motion sickness. And obviously, if they have a concussion and then they have delayed symptoms and they get in a car, that all kind of exacerbates it, which then possibly then leads them to throwing up in a car because of that. So they kind of have an increase in vestibular symptoms, an increase in motion sickness symptoms, and you put all that with a concussed person in a car is not a good situation.
Now, it used to be in the military that if you had a concussion, you had to retake your driving test with an instructor in the car with you. And I was talking, I think it was to Sydney Hines, I was talking to somebody saying, I always point this out in civilian talks that the military has this standard, and I guess it had been dropped at some point. But I thought that was interesting, that they wanted to really make sure there was a return to drive protocol. So I really support this direction that you're going into.
Agree completely.
Any other future thoughts of things that you want to do next?
No, I think just at this point in my career is just to support my doctoral students and the research that they do, and then my young colleagues who are starting their careers to make sure that they are still successful. Obviously, I'm a program director for our graduate athletic training program at Michigan State University. And we just started our program. This is our cohort of our 2nd year. So I got that up and running, and just continuing to advocate for athletic trainers, particularly in the high school setting. As I said, the state of Michigan, they have done some great things in the state of Michigan in terms of concussions and concussion education for the coaches and for the athletes, for the parents. And then also, the return to play criteria that's mandated, their head injury reporting system, but they still only have 53% of these high schools have an athletic trainer. So I will always advocate for the athletic trainer, particularly at the high school level. I think it is important for these high schools to have the athletic trainers, particularly, and this is where you kind of get into that situation where I understand these schools can't afford it, especially the financial situation that everybody's in right now. And this was pre-COVID. But you have the inner city schools, the free and reduced lunch schools of these individuals who don't even have healthcare. And they really don't have anyone to go to for their healthcare needs. And I just feel like if we can get some athletic trainers into these high schools, they could help these individuals and these students, just regular students, they don't need to be student athletes, just to help them, with the injuries that they have. Athletic trainers are now trained in a variety of different general medical conditions so that they can help them to figure out where they need to go and refer them to individuals. They can monitor them. So I just think it's something that, I do like to get more involved in, is trying to get more athletic trainers out there. As I said, I do recognize that there is a cost that's associated with it, but there are individuals, especially these schools. Unfortunately, it's the schools that can't afford them, but those are the students who need them. So those are the students who really need to have somebody there advocating for their health and safety. And as I said, it's not necessarily in terms of being an athlete, it's in terms of them just being healthy, being
Stop this
well.
driving shit.
Yes. Oh, what did she say?
I don't know. I missed that. But yeah, no, it's trying to figure out a way that to have athletic trainers be available for all students, since all students participate in gym in some sections. I mean, in some part of their high school career, they're going to be taking gym. And we're talking about gym class concussions and whether those in the state of Connecticut, the gym class concussions don't fall under our Connecticut concussion law. Those are students or athletes that play for an official high school sport. There's so many questions. I'm going to let Kara read through some of the questions that were up there. Would anybody like to raise their hand and ask Tracey a question while we're reading through some very long questions on the chat? Or Abigail, would you like to add anything?
I don't have any specifics to add. Tracey did a good job, but happy to answer any questions with her if that's helpful.
It might be helpful, Abby. That's why you had your former doctoral students on it.
I'd be happy to read the questions. I just actually have one of my own. Is that I personally had a very severe traumatic brain injury, and also in going through my journey of, rehabilitation, came across many people who had a serious injury similar to myself. My driver's license was never suspended or taken away. And I was really, and I see somebody else wrote that in the comments as well, and when I did return to drive, and I live right near New York City, so I drove in New York City too, and I had a couple accidents, and granted they were minor, and my family just settled them because they felt if there was any litigation or whatever, it would obviously be my fault. But I was just curious if whether in Michigan or in other places that you've heard of, if there's any protocol or rules about that, or whether it's up to the schools or to the rehab centers or the doctors. I mean, not even necessarily that they go there, but I just think it's such a risk, and whether it's impulsivity or just any other issues, that it's just that that should be involved. And I was curious what you thought about that.
In terms of concussions, so mild TBIs, there's actually no standards for that in terms of reporting it or anything. In terms of if you have a moderate to severe TBI, then I think there are standards that fall into play of whether or not they would lose their driver's license, but it's going to depend on the severity of that TBI. So it's similar to the software that we were fortunate enough to purchase as a TBI software that they actually use to retrain individuals with a TBI to be able to drive again. But whether or not they suspend their driver's license, that I actually don't know. I always think it's New Zealand driver's license was suspended for 6. Is that in New Zealand? Who just wrote that?
I did.
So I have a question then for Elizabeth. Is it in New Zealand your driver's license is suspended, or you live in the US now and they suspended it?
No. I was in New Zealand at the time. And yeah, the New Zealand driver's license, they took it off me and said no driving for 6 months. But I think that was because I had a seizure following the crash. I think that's what I've been told. But
yes, I do know if you have a history of seizures, they do suspend your driver's license for 6 months and you have to be seizure free. But I have not heard, other than those severe cases of TBI, which I feel like there's other issues that patient is dealing with, obviously being able to walk again, being able to speak again, being able to function cognitively are the things that they're working on with that one. But I haven't, in terms of concussions, there's nothing. So there's nothing that they will take away your driver's license for.
Or even test you. I mean, it's a risk to other people, but also to yourself as well.
Sure.
I see a question here from Joanne Andrews. Do you know how many of the players had previous concussions in your research, and if the time for full return to play was longer than expected because of that, because they may have had some previous concussions? So was that at all taken into consideration?
And I guess I'm going to ask that question to Joanne. Are you referring to the study of the soccer athletes?
I actually typed that in as Katherine was asking the same question and hit return when she finished her question. So I think that question's actually already been addressed when Katherine was asking about previous concussions and length of time to return, and talking about the sports where you might expect to see previous concussions because kids are much younger when they start out. So I think that's been addressed, but thank you.
Okay.
I wanted to go. Nat
oh, sorry.
had her hand up. Let's go to Nat, and then Kara will go back to you. Nat, do you want to speak?
Hi, thank you. Thank you for the presentation. I find the work very, very fascinating. I think one of the things about driving is helping, I'm a 4-time brain injury survivor, helping people understand I have the right to take my life in my hands, but I don't have the right to take someone else's life in my hand as a concept when we begin driving again. But the other prong of that is making sure as much as possible that communities have transportation support for folks so that they don't have to make that choice to drive or not drive, aside from, I want to drive, I have the right to drive, but really looking at personal responsibility, but then also resources to get transportation until you are safe to drive again, so we don't place ourselves and others back in that risk factor that Tracey so beautifully demonstrated in the test car. Thank you.
Yeah, and I have to completely agree with that, because if we think about it, if you are in a community where you don't have access to either transportation, to buses to get where you need to go, or you're just literally out, like my parents live an hour and a half north of Toronto, and I'm telling you, they are so far out in the middle of farmland. It's, it's thank God for my mother, Amazon driver finally figured out where the house was, but it took them a while. But it's that issue, with the whole transportation issue. People are like, if I need to get to work and I can't drive, how am I going to do it? So then they're like, okay, I'm just going to not tell anyone, keep my driver's license and drive. But the one thing that we always say is, I think unlike sports, and I understand, like if you play hockey or football, you could hurt another person, and I completely understand that. But if you get in a car, you risk hurting another life. And that's where I think people really need to think about that.
And I think too that these are students going into either a high school setting or a college setting where people are distracted and walking around and feeling, sort of, that they have more of the share of the road. And I know certainly that's been an issue with high school concussions around here, is that the student was cleared to come back 2 hours a day, but they didn't have rides back and forth, and the bus system couldn't be organized to do that. So they ended up taking a family car back and forth.
Or the ability to utilize the bus system is not possible because of the head injury. And of all of my head injuries, they were all from distracted drivers who are not impaired by substances or other brain injuries. They just were not paying attention. So I think it's really the providing that support to have rides as actually part of treatment and for future prevention for not only the survivor of the head injury, but the others that are at risk because of the head injury. And no one ever took my license away either, but I learned to recognize when I needed to remove my privilege to use the license so that I didn't put someone else at risk. But this is very interesting. I'm going to look up your JAMA article. Thank you.
I think it also changes in certain states. I did my rehabilitation in New Jersey, and there was like the state, through the Traumatic Brain Injury Fund program and Traumatic Brain Injury Waiver, paid for transportation. So they took me to my rehabilitation program, which was a daily program, both in New Jersey and then later in New York City as well, which was really amazing. And I know that in New York, they didn't have the same. So it's definitely something that should be on the radar.
I think over time, for severe traumatic brain injury, resources have been cut. So there are less services than, at least when Marilyn Spivak presents, there are fewer services than there used to be. We always think of things are additive, but that we've lost services from brain injury. Any other questions from the live crew before Kara goes to read another one from the chat?
I think Elizabeth has a question.
Sorry, I was trying to unmute. Yeah, I may have missed this at the start, but do you guys find any differences in the actual mechanism of the concussion in your soccer study or any other sports between sexes?
We did. We found that females were more likely to be hit by an object, and males were more likely to hit a player.
And what do you think?
Sorry, just
for that finding, is there recommendations to coaches and refs?
Oh, Abby.
So I think what our main finding in that there were differences is that we might start to shift how we look about sex comparable sports overall, and that we can use this information to kind of guide those policies or guide those decisions. And that could be in training for refs, in rule changes, in how people practice and play. I wouldn't say anything specifically exists yet in those sex comparable sports, but if you think about like lacrosse versus in males and females, like the whole game is different. And so style of play is different. And so concussions are likely going to occur different ways in those types of sports overall. So I think the information that we provide early on can help inform those policies or education for those involved in the sport beyond the athletes.
Excellent, thank you. Kara, do you have a question from the chat?
Yes, from Hillary Loftus. She said, did you happen to study the type of treatments that student athletes received for their concussions before return to play, such as like physical therapy, medical grade hyperbaric oxygen therapy, vestibular therapy, ocular therapy, and whether this made a difference in their time frame for recovery?
We did not have access to that data, so the head injury reporting system did not actually include any type of treatment, including academic accommodations with it. So we were not able to do that. I do know that that is also where the current literature is going towards, is the management and the treatment of concussions of, is there particular types of vestibular therapy that will decrease the amount of time that the athlete has symptoms or the student has symptoms, as well as ocular therapy. And that is something that I know that's been studied a lot at UPMC with some colleagues there look a lot into the vestibular therapy that they have and targeted vestibular therapy that's going on. I will say the one, I think it goes back to the whole conversation that Nat was saying and the access to it, is it's difficult to get access to vestibular and ocular therapy because they are select individuals who are trained in it. And then you're also looking at times, when you have that concussion, figuring out, so right now we have clinical profiles early on to determine which type of therapy that they should be going into, but then trying to get them into those PT clinics to get access to those therapies can be difficult. It's just one of those things where I think a lot of the profession is going into, but trying to now increase access to these different types of treatment. I think, academic accommodations is something that the schools, some schools, I'm not going to say all schools, but some schools are doing well and trying to decrease the amount of cognitive stress that's placed upon students, either at a high school or a collegiate level. But in terms of then going, further into that vestibular ocular therapy or pharmacological agents, it is something that's difficult if you don't have access to it.
Okay. The next question, do your studies, Tracey and Abigail, cover anyone like Pat Baird's daughter who had concussions, like multiple concussions from different causes? She had a concussion from a car accident in 2011, 2 soccer concussions in 2016, another in 2019, and she still has ongoing executive function issues now.
We've never actually separated them out from sport-related and non-sport-related concussions. The problem is a lot of our data collection in the past didn't necessarily distinguish whether or not, even for us at Michigan State University, as awful as it sounds, but we have student athletes who fall out of their bunk beds and get concussions that are non-sport related. We also have those scooters, those electric they got the bird and the bike and the gotcha and all those electric scooters that these kids run around with on campus. It drives me up the wall because none of them wear a helmet. It's like my biggest pet peeve. And then they don't pay attention, and then they get hit by a car, and then they end up with a concussion, and then they come in our study. But we haven't actually separated that out. But I do agree there's, it's the one thing that, to go back to also talking about, in terms of management and what else individuals need to do, a healthcare provider, they do need to ask, when you ask an individual if they had a concussion, if they're an athlete, they only think about their sport related concussion that they tell you. They don't tell you the time that they ended up being in a car accident or they fell off of their bike. When they were 12 years old, they ended up falling off of their bike. They might associate that with sport because a bike is a sport, but typically, when we ask these students, do you have a concussion? They don't ever think about these things. They really only think of, if you have a football kid, how many concussions did I have playing football? And we always try to probe them and say, did you have any accidents in a car accident? Did you fall off your bike? Did you fall off the monkey bars when you were younger? Did you have these type? And then they're like, their parents and them are like, oh yeah, he had this concussion. So it's definitely something that does need to have more research in. But to go back to that, it is difficult because regardless of how you get your concussion, they do add up. So it's the one thing, if you think about it, when you were younger and you had that child that fell off the monkey bars, got a concussion, and then now they're 10 years old, fell off their bike, got a concussion, or off their scooter, and now they're 12 years old and they have a soccer concussion, and then they're 15 years old, have another soccer concussion. It's really, they've had 4 concussions, and that has been shown to, decrease or exacerbate those symptoms that they have and the amount of time that it takes for them to recover.
I have a question. We were talking earlier about the study, which I think a former graduate student of you, is it Amy Wallace, talked about. Jessica, about the racial differences in the concussion they've studied, and the higher number of African-American teens and adolescents who had concussion from assault. And I feel like most of the concussion education concussion research starts at the college and then expands out to the above college or below college. How in the future do you think we can include assaults at the college level, fights into this research, if that is a group of concussions we're not studying right now?
I think it really depends on the situation and on the college. So I think, there's always been the debate of what do student athletes get compared to the rest of the student population. So, let's just be clear. If you're a student athlete, you have access to healthcare. Again, that does depend upon the institution, the size of the institution, and the facilities of the institution. Compared to if you are just a student on campus. Well, all universities and colleges obviously have access to healthcare for those individuals who have been assaulted. I think, how they get handled after that assault can tend to be a little bit different in terms of that. And I think there needs to be, more advocates for the healthcare in that. I do think in terms of the assaults that happen, on campus, there's also the whole reporting issue. That comes into whether or not these kids are going to get kicked out of their dorms, whether or not there's other issues that happen with it. So there's always been that problem that has happened with that. But it is something, that obviously if you're assaulted and, you take punches to the head, you probably, have a possibility of getting a concussion, and then you need to actually go and get some good healthcare with that. But there's also that thing of, that individual might be, I don't want to say intimidated to go, but embarrassed to go, that, they went to a bar and got in a bar fight. So they don't want to be that person, even though they should be getting that healthcare. So it is difficult, but it is something that obviously there needs to be an increase in it.
And I was explaining in the high school student population that I've been studying for the last 5 years in my city, that they didn't want a assault to be one of the categories, one of the mechanisms of injury. Those are put under other because that had a whole reporting aspect to it. So again, I think the athletes that have athletic trainers, I'm grateful that they're to be studied so that we get this data, but it's how to expand it out. And then another category that we've had trouble with is that, you know, people don't fit into this neat male and female construct that we've had. So how do we keep moving forward and study people and how they see themselves as their identities and come up with research that makes sense that we can act on? Any thoughts on?
I still think the one big thing is to make sure that there's an individualized focus on the individual who has a concussion. So whether or not, you know, I still, you know, even it's so hard because we don't know how long it's going to take for these individuals to recover from their concussion. So that has always been hard to put, should there be male and female guidelines, because we don't know. There could be a female who could take 28 days and there could be a male who could take 42 days. So we're still going to have to treat them individually as separate individuals with concussions. I think the one thing, you know, where I've always said there needs to be that more focus, and that's where that male and female comes in, is explaining to parents, explaining to clinicians, explaining to the general population that females, you know, they are definitely at risk for getting a concussion, that this isn't all about football and ice hockey and boxing, that people don't understand that in volleyball, girls get concussions. So it's not necessarily taking a different approach of we're going to treat a female differently from a male. It's understanding that the female will get the concussion, is understanding that the female will probably have an increase in vestibular symptoms. So then that's you knowing that you should probably try to get them into vestibular therapy. So it's understanding, you know, even with, we talked about, you know, those different treatments of vestibular, ocular therapy, academic accommodations, any type of pharmacological agents. So we know that females tend to have more of the affective symptoms, so the emotional symptoms. They might have more an increase in anxiety after their concussion. So it's knowing that and then getting them that treatment to help them with their concussion. So it's definitely having that clinician knowing that, hey, you do have a volleyball player who's 14 years old who just had a concussion. And by the way, your female athletes could be at an increased risk for these type of symptoms, so you should look out for them. So it's almost not necessarily, again, putting that like one size fits all for females and one size fits all for males, but it's still doing an individual approach. But it's also saying that we need to be aware of what could be possessed differently in that female, and we should definitely be aware of that. And one of the things is the vestibular symptoms. So definitely those vestibular symptoms. The other thing is migraines. So females, just in a general population, I believe it's now like 13% prevalence of all females have an increase in migraine headaches, compared to around 7% of the population has it for males. So knowing that if there's an increased risk in migraines, that maybe that those females are going to have that increase in their headache, increase in sensitivity to light, sensitivity to noise. So being aware of that as well as a clinician. But then also, you know, even it should be the clinician should be also informing the parents to have them to become aware of that. You know, if you have a female who has this concussion, be aware of these symptoms. If you have a male, they might tend to have more of these symptoms. So just to become aware of it is one of the big things that I do think needs to have an increased focus on, rather than necessarily saying like switching, here's the guidelines for male, here's guidelines for female. We still want to do individual, but we want to be aware of what things are different in a male and a female.
And do you find that, you know, especially in the last 10 years, that we're all making progress in that direction, that there is more awareness out there?
I do, because I think when I started, you know, if I had a few parents who literally came up to me when I was doing concussion education going, you know, my son plays football and he's going to be in the meeting like right after this. So I was like, yes. He's like, well, you're talking to my daughter who plays volleyball. And I was like, yes. Do you know she could get a concussion? And he's like, really? And I was just like, wow. So I think, when I think back to that time, I think yes, but I also think of it, if we think back, 30 years ago, think of heart disease and think of heart attacks, right? So back 30, 40 years ago, it was always like the males are going to get the heart attacks. And it wasn't something that clinicians were really like made aware that there are different symptoms definitely in heart attacks for a female. And back then, 30 or 40 years ago, it was always like, okay, it's like your husband's going to have the heart attack, your father's going to have the heart attack. And it's sort of like, you probably might want to be aware that your mother might be the one having that heart attack. So I think, as like now it's completely changed where everybody knows about heart attacks and females also having, that increase in possibility of having it. I think it's the same thing with concussion. So to answer your question, I do think we've made progress in that. I think that it is definitely out there. To me, it's always unfortunate because you always end up having these high profile athletes who unfortunately get concussions, but make people aware of it. And it's kind of that situation, which is, also evolved and they're seeing the high profile females who are getting the concussions as well.
There's so many good questions coming in, but I think we're at the end of our time. Cara, you want to just pick one more question and I'll just start thanking everybody for being here.
There's one about elementary school sports, and I don't know if you've done any research or what your awareness is in that context. The question is if they have athletic trainers there. And this woman, Hillary, said she's working with a badly concussed lacrosse player at age 11 who was misdiagnosed with dehydration rather than a concussion and allowed to play a week later. Had to be hospitalized for 8 days and given a lumbar puncture after attending a trampoline birthday party the next day.
So to answer your question, there are very few, if any, athletic trainers at elementary schools. There are a few at middle schools, but even those are hard to find. So sometimes the school district will say that you are responsible for a high school and the middle school because the middle school is right next to it. But as far as elementary school, no, absolutely not. To go back to the question, also the 11-year-old girl, I've actually seen that before. I don't want to say a similar situation, but an individual who was 14, and this was at a high school, but it was in a way one of those AAU soccer games. Girl had a concussion, and this was back a while ago, but unfortunately the ER doc told her she could return 2 days later. So she did, I think 10 days later, got a second concussion, and then did end up having like seizures on the field, ended up in the hospital. But she is fine now, but it was definitely one of those similar situations. And this goes back to making sure, and as I said, this was definitely years ago when the ER docs used to say, hey, when you know symptoms, you can go back 2 days later. So don't ever do that. But it is a situation where specifically at those elementary schools, it's a big thing, right? Like if you think about it, I always talk about the monkey bars. And kids falling off the monkey bars, kids getting a concussion, trampolines, they're one of the, they're a nightmare in terms of injuries, as much as we all love to jump on them. I will say that. But in terms of injuries, you definitely get a lot of injuries with trampoline. But it is unfortunate for that. But I have not seen at an elementary school, no athletic trainer. We're just trying to get them in a high school.
I know in Concussions, we were talking about doing research and doing outreach, like to pediatricians' offices, also, to teach more about the impact on women and hormones and that kind of thing, but just in terms of if there's any injury, and that's the first stop, for children, then in terms of concussion screening for girls and boys, included in their assessment.
Well, thank you so much, Tracey. There are some really nice comments thanking you in the chat. I will copy that and send you so you can read it at your leisure. Thank you, everybody, for coming and spending another afternoon with us. Really appreciate it. And we'll be back next week. We have casual conversations planned till mid-July. We'll take the last 2 weeks in July off for our conference and then take August off, and we're already booking into September. So you guys keep showing up and we'll keep doing conversations. Thank you, Tracey. Really appreciate it.
Thank you everyone for joining.
And really, you were the first researcher I found that caused me to launch Pink Concussion. So I'm so happy to have you here, and thank you. Appreciate all that you do for us.
No problem. Thank you for everything.
Take care, everyone. Have a good week. We'll see you next week. Bye-bye.
Thank you. Bye-bye.